Okay, we need to talk. There are so many myths about therapy floating around that are stopping people from getting help they actually need. So today, I'm busting the top 5 therapy myths that seriously need to die. Let's go! Myth number 1. Therapy is only for people with serious mental illness. Wrong. Therapy is for literally anyone who wants to improve their mental health, work through a tough time, or just understand themselves better. You don't need to be in crisis to deserve support. Going to therapy is like going to the gym. You don't wait until you can't walk upstairs to start exercising, right? Therapy is preventative maintenance for your mind. Whether you're dealing with everyday stress, a major life transition, relationship issues, or just want to level up your emotional intelligence, therapy is for you. Myth number 2. Therapy is just like talking to a friend. Listen, I love my friends, but no. Your therapist has years of training in psychology, evidence-based techniques, and professional boundaries. They're not going to trauma dump on you about their problems, judge you, or gossip about you at brunch. Plus, a good therapist will challenge your thinking in ways friends might not. They'll call you out on your patterns, teach you actual coping skills, and give you tools that are backed by research. Your friends are amazing, but they're not a replacement for professional help. Myth number 3. Therapy takes forever. You'll be stuck there for years. Not necessarily. While some people do long-term therapy, many types, like CBT, are short-term and goal-focused. We're talking 12-20 sessions for a lot of issues. Think of it this way. Some people go to therapy for a specific problem and graduate. Others treat it like a regular checkup. Both are totally valid. You're in control of how long you go, and you can always take breaks or come back when you need to. Myth number 4. If you need medication, therapy failed. Absolutely not. Sometimes therapy and medication work best together, like peanut butter and jelly. Medication can help balance brain chemistry, while therapy gives you the skills and strategies to manage your mental health. There's zero shame in taking medication. You wouldn't tell someone with diabetes that insulin means they failed. Same logic applies here. Use whatever tools help you thrive. Myth number 5. If you don't click with your therapist immediately, therapy won't work. Here's the truth. Finding the right therapist is like dating. Sometimes you need to try a few before you find your match. It's completely okay to switch therapists if it's not working. A good therapist won't be offended if you want to try someone else. The most important thing is finding someone you feel safe with and who uses approaches that work for you. Don't settle. So there you have it. 5 therapy myths officially busted. Therapy isn't scary, it's not forever, and it's definitely not just for other people. It's a tool, and you deserve to use every tool available to live your best life. Which myth surprised you the most? Drop it in the comments. And if this helped clear things up, hit that like button and subscribe for more mental health real talk. You've got this.